Palliative Care in India, meticulously edited by Professor Dr. Atma Prasanna, consultant in pain and palliative care here at Sri Shankara Cancer Hospital and Research Center. I welcome you, sir. We are very honored to have you here. We are truly honored and delighted to welcome our chief guest for this morning, Honorable Member of Parliament, Bangalore Rural, Dr. C.N. Manjunath. Sir, your presence elevates this occasion immeasurably, and we extend a very heartfelt warm welcome to you.
ಶಾರದೆ ಕರುಣಾನಿಧೆ ಸಕಲಾನವಾಂಬ ಸದಾ ಜನಾನ್ ಶಾರದೆ ಕರುಣಾನಿಧೆ ಸಕಲಾನವಾಂಬ ಸದಾ ಜನಾನ್ ಚಾರಣಾದಿಮಗೀತ ವೈಭವ ಪೂರಿ ತಕಿಲ ದೀಕ್ತತೆ ಶಾರದೆ ಕರುಣಾನಿಧೆ ಸಕಲಾನವಾಂಬ ಸದಾ ಜನಾನ್ ಚಾರಣಾದಿಮಗೀತ ವೈಭವ ಪೂರಿ ತಕಿಲ ದೀಕ್ತತೆ.
ನನ್ನ ಆತ್ಮಶ್ರೇಯಿತರಾದ ಶೇಖರ್ ಪಾಟೀಲ್ರವರೇ, ನಮ್ಮ ಇಲ್ಲಿ ಬಂದಿರತಕ್ಕಂಥ ಶಂಕರ ಕ್ಯಾನ್ಸರ್ ಫೌಂಡೇಶನ್ನ ಟ್ರಸ್ಟಿಗಳೇ, ಈ ಪುಸ್ತಕದಲ್ಲಿ ತಮ್ಮದು ಒಂದು ಕಾಂಟ್ರಿಬ್ಯೂಷನ್, ಬಹಳ ಶ್ರೇಷ್ಠ ಮಟ್ಟದ ಕಾಂಟ್ರಿಬ್ಯೂಷನ್ ಮಾಡಿರತಕ್ಕಂಥ ಸುಮಾರು 100 ಜನ ಆಥರ್ಗಳಿದ್ದಾರೆ. ಇದರಲ್ಲಿ ಡಾಕ್ಟರ್ ಆತ್ಮಪ್ರಸನ್ನ ಅದನ್ನೆಲ್ಲರನ್ನೂ ಹೇಗೆ ಒಂದುಗೂಡಿಸಿದರೋ ನನಗೆ ಆಶ್ಚರ್ಯ ಆಗುತ್ತೆ. ಆದರೆ ಅದು ಆತ್ಮಪ್ರಸನ್ನರವರ ಶಕ್ತಿ ಅಂತ ನಾನು ಅಂದ್ಕೊಂಡಿದ್ದೇನೆ. ನಮ್ಮ ಸಂಸ್ಥೆಯ ಚರಿತ್ರೆಯಲ್ಲಿ ಇದು ಒಂದು ಬಹಳ ದೊಡ್ಡ ದಿನ. ನಮ್ಮಲ್ಲೇ ಇರತಕ್ಕಂಥ ಒಬ್ಬ ಶ್ರೇಷ್ಠ ವೈದ್ಯ ಪ್ಯಾಲಿಯೇಟಿವ್ ಕೇರ್ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ, ಅದು ಭಾರತ ದೇಶದಲ್ಲಿ ಪ್ಯಾಲಿಯೇಟಿವ್ ಕೇರ್ ಹೇಗಿದೆ, ಹೇಗಿರಬೇಕು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಎಲ್ಲರನ್ನೂ ಒಟ್ಟುಗೂಡಿಸಿ ಒಂದು ಉನ್ನತವಾದಂತಹ ಶ್ರೇಷ್ಠವಾದಂತಹ ಪುಸ್ತಕವನ್ನು ನಮ್ಮ ಭಾರತಕ್ಕೆ ಅವರು ಕೊಟ್ಟಿದ್ದಾರೆ. ಇದು ಬಹಳ ಕಷ್ಟ. ಪುಸ್ತಕ ಬರೆಯೋದು, ಒಂದು ಚಿಕ್ಕ ಆರ್ಟಿಕಲ್ ಬರೆಯೋದೇ ಕಷ್ಟ. ಒಂದು ಪುಸ್ತಕ ಬರೆಸೋದು, ಅದನ್ನು ಅದೆಷ್ಟು ಬಾರಿ ಎಡಿಟ್ ಮಾಡಿದಾರೋ ನನಗೆ ಗೊತ್ತಿಲ್ಲ. ಓದಿ ತಿದ್ದಿ ತಿರ್ಗಾ ಅದನ್ನು ಸರಿ ಮಾಡಿ ತಿರ್ಗಾ ವಾಪಸ್ಸು ಪ್ರಿಂಟರ್ಗೆ ಹೋಗಿ ಇದು ಮಾಡೋದಕ್ಕೆ ಬಹಳ ಕಾಲ ಹಿಡಿತು. ಇಲ್ಲದಿದ್ದಲ್ಲಿ ಈ ಪುಸ್ತಕ ಈಗ 6 ತಿಂಗಳ ಹಿಂದೆನೇ ಬಿಡುಗಡೆ ಆಗಬೇಕಾಗಿತ್ತು. ಅವರಿಗೆ ಮನಸ್ಸಿಗೆ ಅದು ತೃಪ್ತಿ ಆಗಲಿಲ್ಲ, ಅದು ಸರಿ ಹೋಗೋವರೆಗೂ ತೃಪ್ತಿ ಆಗಲಿಲ್ಲ. ಕೊನೆಗೆ ಎಲ್ಲ ಸರಿಯಾಗಿ ಆದಮೇಲೆ ಅದನ್ನು ಪ್ರಿಂಟಿಂಗು ಮಾಡಿದೆವು. ಈಗ ಆ ಪುಸ್ತಕ ಬಿಡುಗಡೆ ಆಗಲಿದೆ. ನಾನು ಅದರ ಬಗ್ಗೆ ಜಾಸ್ತಿ ಹೇಳಲ್ಲ, ನಾನು ಇಷ್ಟೇ ಹೇಳೋದು, ಪ್ರತಿಯೊಬ್ಬ ಬರಹಗಾರನು ಬಹಳ ಚೆನ್ನಾಗಿ ಬರೆದಿದ್ದಾರೆ ಹಾಗೂ ಸುಲಭವಾಗಿರ್ತಕ್ಕಂಥ ಇಂಗ್ಲೀಷ್ನಲ್ಲಿದೆ. ಅದು ಪ್ರತಿಯೊಬ್ಬರಿಗೂ ನಮ್ಮ ಭಾರತದ ಸಂಸ್ಕೃತಿ, ಆಹಾರ ಮತ್ತು ವಿಚಾರಗಳು, ನಮ್ಮ ನಡವಳಿಕೆಗಳು, ಇದನ್ನೆಲ್ಲ ಅವಲಂಬಿಸಿ ಮಾಡಿರತಕ್ಕಂಥ ಒಂದು ಪುಸ್ತಕ ಇದು. ಪಾಶ್ಚಿಮಾತ್ಯ ದೇಶದಲ್ಲಿ ಇರತಕ್ಕಂಥ ಆಹಾರ ಪದ್ಧತಿಗಳನ್ನ ಇದರಲ್ಲಿ, ಈ ಪುಸ್ತಕದಲ್ಲಿ ನೀವು ಕಾಣೋದಿಲ್ಲ. ನಮ್ಮ ಭಾರತದ್ದೇನಿದೆ ಅದನ್ನು ನೀವು ನೋಡ್ತೀರ. ಆದ್ದರಿಂದ ಇದನ್ನು ಓದೋರಿಗೆ, ಪಾಠ ಹೇಳಿಕೊಡೋರಿಗೆ, ಅದನ್ನು ಚಿಕಿತ್ಸೆಗೆ ಉಪಯೋಗಿಸ್ಕೊಳ್ತಕ್ಕಂಥ ವೈದ್ಯರಿಗೆ ಎಲ್ಲರಿಗೂ ಇದು ಬಹಳ ಉಪಯೋಗವಾಗ್ತಕ್ಕಂಥ ಪುಸ್ತಕ ಅಂತ ನನಗೆ ಅನಿಸುತ್ತೆ.
I am here today to talk on behalf of my husband, Dr. Atma Prasanna, editor and one of the authors of this book on palliative care in India. We both feel highly honored and elated to witness the book release today. It culminates many years of his hard work. At the outset, Dr. Prasanna and I sincerely thank Dr. Manjunath for gracing this occasion despite his busy schedule. Dr. Srinath deserves our endless gratitude for having done everything in his might to bring this book to light. Our sincere thanks goes to the publisher, Mr. Aditya Prakash, and his team members, especially Mr. Suresh, for bearing with us. May I request you all to please permit me to share in short Dr. Prasanna's journey of hard work and compassion for patients in distress. He says his interest in pain relief started from his student days in PGI Chandigarh, but it turned into passion since 1984 while working in KMC Manipal, that is Kasturba Medical College, Manipal. One day during his post-operative ward round, he says one of his post-cancer surgery patient begged for the same drug, saying the same drug to be administered, which he gave her to relieve her pre-operative cancer pain epidurally, because it gave her intense relief to the pain. He says as he started making a difference in post-operative pain relief, he realized the need for a dedicated pain clinic. In 1987, with the support of hospital administration, he started a pain clinic in KMC Manipal, catering to all types of pain. He was rendering this service after his regular duties as an anesthetist in OT. It was during 1986 and 87 he succeeded in procuring oral morphine tablets for cancer pain patients, going through government at many levels to convince each one for such license. It was a challenging task. KMC Manipal became the fourth hospital in India, besides Ahmedabad, Mumbai, and one more place. And fourth was KMC Manipal to procure oral morphine those days. In 1989, on a 6 weeks fellowship for pain management, he visited 6 medical university hospitals, namely at Atlanta, Kansas, Loma Linda, Nashville, Wisconsin, and Cincinnati. On his return, he noticed there were increased number of cancer pain patients attending his pain clinic. In 1990, a 3-month fellowship on palliative care drew him to St. Christopher's Hospice in London under the guidance of Miss Gilliburn. He also then attended Guy's Hospital in London. Coming back to KMC Manipal, he started a palliative care ward next to the pain clinic, thanks to the then medical director of KMC, for Dr. Ramdas Pai. He inaugurated the ward. The one who encouraged him throughout was Miss Gilliburn, who visited his ward later. However, meeting the challenges of space, staff, equipment, drugs, and funds was no cakewalk. In the long run, it became very rewarding to see his postgraduate students who went through 2 months rotating mandatory posting in pain. And later, it was pleasure for him to see them grow, have their own pain clinic, and reaching high posts. One of them is Dr. Lingegowda, whom we remember as a postgraduate student, and today he is a big man. Now, in 1996, however, this chapter of his life closed, and he found himself land in Royal Hospital of Muscat, Oman. It was Oman government's tertiary level reference hospital where he worked. There also he started the first ever pain clinic in Royal Hospital. He also led a national project to start pain clinics in many secondary level hospitals of the country, Oman. In 2014, he returned to India and joined his good friend Dr. Srinath in this very hospital. And thanks to Dr. Srinath, once again he started a separate OPD for pain and palliative care. His oncologist colleagues like Dr. Shekhar and Dr. Tippeswamy, etc., kept referring outpatients and inpatients for care of terminal cancer patients. He remembers you all the time, and he told me especially that Dr. Shekhar used to send me cases. And these suffering patients were delight for him to give them relief. He took keen interest in providing pain relief, care and comfort, all-round comfort, to all his patients. Throughout his working days, from the beginning, he exercised his research mind also and wrote many research papers. The last paper was published in a journal, Dysphagia, an international journal, in September 2025. It was about he was trying to find why there is difficulty in swallowing in terminal cancer patients. And he did sputum analysis with Dr. Nagasuma, and they published this paper with the findings which were found important. For comfort of terminal cancer patients, he established a home care service for those patients who wanted to stay home. A doctor and a nurses team visit them once a week, even today. He finally decided to pen a book for Indian patients treated by Indian doctors in India. This was his dad's wish. He invited his brilliant colleagues from all over India and even from this very hospital to contribute their clinical experience in form of chapters in this book. The authors include doctors, nurses, physiotherapists, occupational therapists, and others dealing with insurance policies, spiritual aspects, music therapy, etc. Thus, this book can serve as a textbook and referral book for palliative care in India. Dr. Prasanna sincerely wishes palliative care to flourish as a specialty, bigger, better, and more accessible to all patients across India.
Ladies and gentlemen, the textbook Palliative Care in India has been officially released. A historic moment for healthcare education in our nation. Please join me in a very warm round of applause. It's now my honor to invite our distinguished chief guest, Dr. C.N. Manjunath, to address this gathering. Thank you.
ಶಂಕರ ಕ್ಯಾನ್ಸರ್ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ ಮತ್ತು ರಿಸರ್ಚ್ ಸೆಂಟರ್ನಲ್ಲಿ ಪ್ಯಾಲಿಯೇಟಿವ್ ಕೇರ್ ಇನ್ ಇಂಡಿಯಾ ಎನ್ನುವ ಪುಸ್ತಕವನ್ನು ನಾವು ಲೋಕಾರ್ಪಣೆ ಮಾಡತಕ್ಕಂಥ ಈ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ನನ್ನನ್ನು ಆಹ್ವಾನಿಸಿದ್ದಕ್ಕೆ ಶಂಕರ್ ಕ್ಯಾನ್ಸರ್ ಸಂಸ್ಥೆಯ ಫೌಂಡರ್ ಆದಂಥ, ಟ್ರಸ್ಟಿ ಆದಂಥ, ಆತ್ಮೀಯರಾದಂಥ ಡಾಕ್ಟರ್ BS ಶ್ರೀನಾಥ್ ಅವರೇ ಮತ್ತು ಪ್ಯಾಲಿಯೇಟಿವ್ ಕೇರ್ ಇನ್ ಇಂಡಿಯಾ ಈ ಪುಸ್ತಕವನ್ನು ಎಡಿಟ್ ಮಾಡಿರ್ತಕ್ಕಂಥ ಆತ್ಮೀಯರಾದಂಥ ಪ್ರೊಫೆಸರ್ ಡಾಕ್ಟರ್ ಆತ್ಮಪ್ರಸನ್ನ ಅವರೇ ಮತ್ತು ಅವರ ಸಹಧರ್ಮಿಣಿಯಾದಂಥ ಡಾಕ್ಟರ್ ಅಮಿತಾ ಪ್ರಸನ್ನ ಅವರೇ ಹಾಗೂ ಇಲ್ಲಿ ನೆರೆದಿರ್ತಕ್ಕಂಥ ಎಲ್ಲ ಶಂಕರ್ ಕ್ಯಾನ್ಸರ್ ಆಸ್ಪತ್ರೆಯ ಟ್ರಸ್ಟಿಗಳೇ ಮತ್ತು ತಜ್ಞ ವೈದ್ಯರುಗಳೇ ಮತ್ತು ಸ್ನೇಹಿತರೆ, ತಮ್ಮೆಲ್ಲರಿಗೂ ನನ್ನ ಹೃದಯಸ್ಪರ್ಶಿ ಧನ್ಯವಾದಗಳು ಮತ್ತು ನಮಸ್ಕಾರಗಳು. ಇವತ್ತಿನ ಈ ಬುಕ್ ರಿಲೀಸ್ ಫಂಕ್ಷನ್ ಏನಿದೆ, ಇದು ಒಂದು ಐತಿಹಾಸಿಕ ಒಂದು ಬಹಳ ಅರ್ಥಪೂರ್ಣವಾದದ್ದು ಮತ್ತು ಅನನ್ಯವಾದಂಥ ಸಮಯ ಅಂತ ನಾನು ಭಾವಿಸ್ತೇನೆ. ಯಾಕೆಂದರೆ ಡಾಕ್ಟರ್ ಆತ್ಮಪ್ರಸನ್ನ ಅವರು ಸುಮಾರು 1985ನೇ ಇಸ್ವಿಯಿಂದ ನನಗೆ ಪರಿಚಯ. ನಾನು ಕೂಡ KMC ಮಣಿಪಾಲಲ್ಲಿ ನಾನು DM ಕಾರ್ಡಿಯಾಲಜಿ ಮಾಡತಕ್ಕಂಥ ಸಂದರ್ಭದಲ್ಲಿ 1985ರಿಂದ 1988ನೇ ಇಸ್ವಿನಲ್ಲಿ ಡಾಕ್ಟರ್ ಆತ್ಮ ಪ್ರಸನ್ನ ಅವರು ಮತ್ತು ಮಿತಾ ಪ್ರಸನ್ನ ಅವರು ನಾವೆಲ್ಲ ಒಂದೇ ಫ್ಲ್ಯಾಟಲ್ಲಿದ್ವಿ. ಅಂದರೆ ಯಾವ ರೀತಿ ಇತ್ತು ಅದು ಸ್ಟ್ರಕ್ಚರು ಅಂದರೆ, ಫ್ಯಾಕಲ್ಟಿ ಆದವ್ರಿಗೆ ಅವರಿಗೆ ಗ್ರೌಂಡ್ ಫ್ಲೋರ್ ಆ್ಯಂಡ್ ಫಸ್ಟ್ ಫ್ಲೋರ್ ಕೊಡ್ತಾಯಿದ್ರು, ಸ್ನಾತಕೋತ್ತರ ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ 2ನೇ ಫ್ಲೋರ್ ಕೊಡ್ತಾಯಿದ್ರು. ಅಂದರೆ ಅದು ಚಿಕ್ಕದು ಒಂದು ಸಣ್ಣ ರೂಮ್ ಇತ್ತು, ಒಂದು ಸಣ್ಣ ಕಿಚನ್ ಇತ್ತು. ಅಂದರೆ ಇವತ್ತು ಈ ಪ್ಯಾಲಿಯೇಟಿವ್ ಕೇರ್ ಇನ್ ಇಂಡಿಯಾ ಏನಿದೆ ಭಾರತ ದೇಶದಲ್ಲಿ, ಅದು ಇನ್ನೂ ಕೂಡ ಒಂದು ಎಲ್ಲ ಕಡೆ ಅದು ಒಂದು ಸ್ಟ್ರಕ್ಚರ್ಡ್ ಪ್ರೋಗ್ರಾಮ್ ಆಗಿಲ್ಲ. ಇಟ್ ಈಸ್ ಓನ್ಲಿ ಇನ್ ಪೀಸ್ ಮೀಲ್. So I really thank Professor Dr. Atma Prasanna for really publishing this great epic. I can say it is an epic of palliative care in India. It is an epic antane mahakavya antane helbekagutte. It is an epic because not everybody can write books. You ask somebody to write even one-page article, they always take about 1 month or may not write at all. So here is a great man who is so passionate about his profession, who is so much connected with his profession, and he is saluting his profession. So that has made him to write despite his physical limitations. So he has edited this really an historic monumental book called Palliative Care in India. Because today what is happening, we have our own guidelines. Take hypertension guidelines, we have Indian guidelines for hypertension. We have Indian guidelines for managing heart attack, Indian guidelines for managing your cholesterol or lipid management. So because all through for so many decades and decades, we have been following, we are copying the Western guidelines, whether it's European guidelines or American guidelines for managing cancer or palliative care. So now this book serves as a great testament and also serves as a great reference book for all palliative physicians and all palliative postgraduate students or DNB students, and also because palliative therapy is not just pain management, it is beyond pain management. So it's a multidisciplinary approach. So this will be a great ready reckoner and also a reference book for a medical oncologist, a palliative physicians, and also anesthetist, physiotherapist, nutritionist, and rehabilitation specialists. So I think because he has really collected lot of articles from more than 100 authors. What is the definition of care? C is basically for compassion, A for attention, R for rehabilitation, E for empathy. So today the main objective of treatment, number one, you should try to completely cure, that is one, and at the same time the quality of life is the one that matters. What is the main sole objective of palliative care? All cancers are not curable. Some are curable, some are maybe controlled. You can limit this thing and you can prolong the life, and you can that is one thing. And some may reach a stage, end stage or refractory stage or untreatable stage. That is where the role of palliative therapy comes in. So in India there are only few dedicated cancer centers which have a structured very academically driven or what is called evidence driven palliative care. So Shankar Cancer Institute is one of the role model cancer institute in this country. My hearty congratulations to the founder and the trustee of this great cancer hospital, Dr. B.S. Srinath, for really taking this cancer hospital to a greater heights. So in fact this particular center, as I was told, it has 500 plus beds, and they have come they have also come up with a Bharati Shankara Cancer Institute in Bhubaneswar, Orissa, that has got 750 beds. See, to build an institution of excellence, to build an institution for a common man, and because today the cancer treatment is pretty expensive, because it doesn't stop with chemotherapy. Now what we have called immunotherapy, then radiotherapy. So I think unfortunately many of these procedures are not included under our government sponsored health scheme. So out of pocket expenditure is very, very high. Out of pocket expenditure is high, although under Ayushman Bharat some of the procedures, some of these drugs are included, but not all of them. So recently the union budget, Government of India, has exempted customs duty on 17 cancer drugs. 17 cancer drugs, and I was pursuing this issue. In fact, I collected all the names of immunotherapy drugs that need to be exempted from custom duty from our B.S. Srinath. Then I took up this matter with the union government and also the Ministry of Finance Minister Nirmala Sitharaman, and also I spoke about this particular issue, that cancer drugs, particularly immunotherapy drugs, need to be exempted from customs duty so that treatment can be reasonably affordable and accessible to a common man in the parliament. Then in response to my appeal, today Government of India has exempted the customs duty on cancer drugs. In fact, when I met Finance Minister Nirmala Sitharaman, she told me, Manjunath, I don't know much about this, and you are a accomplished cardiologist, and you just give me the list of those drugs and I will include in the exemption list. Then I was pursuing this with Srinath. He was busy. Then almost once in 3 days, once in 5 days, I used to call him, give that list. Then ultimately he gave it. So this is where, because the most important is treatment should be more affordable, accessible and available. So this is where possibly we have to put in our policy matters in such a way, because ultimately if it is not possible to cure it, because three objectives of treatment, any treatment: number one, you have to elevate the totally disease, you have to eradicate, that's a complete cure. That's only few cancers are totally curable if recognized in the early stage. Then some can be controlled or contained, and ultimately the bottom line is you have to improve the quality of life. That is very important. As long as they live, they should live with dignity and they should live with a better quality of care. So it is a multidisciplinary approach. And most important is you should have tremendous patience for patients. You should have more. I think that is where, who is an average doctor? Who is a good doctor? Average doctor is one who treats the disease. A good doctor is one who treats the patient. Because patient, in addition to the disease, has lot of symptoms, has emotional issues, has various hidden problems. So this is where probably palliative physicians should have a tremendous patience. And because I think the way we talk, and if you are spending time with a patient, that is also a treatment. Non-medicine medicines they are. Non-medicine medicines, the way we talk, the way we counsel, the way we really infuse confidence in the patients. Because I was just given, patients are extremely sensitive and they are very intelligent and watchful. See, I am in the habit of closing my eyes when I am auscultating the heart, because so that I can focus completely on hearing the heart sounds or the murmurs, whatever it is. So that is my habit. Whenever I am auscultating the heart with the stethoscope, I close my eyes. See, the most important is there are three levels of compassion. Compassion is because we have sympathy, empathy and compassion. Sympathy means what? That means we know somebody is suffering from pain. Then empathy means I am feeling myself that he has pain. But compassion is let me do something to elevate the pain. So one should have sympathy, one should have empathy, one should have compassion. I think this is where, I think today in these days of explosion of technology, today we are in an era of explosion of technology on one side and aggressive marketing forces on the other side, and between these two, patients and doctors or specialists are getting sandwiched between technology on one side and the second one is on the aggressive marketing forces. So we need to really strike a balance. That is the reason three things you should always keep in mind. Three things, they can be called as commandments. They can be called as commandments. What are those three things we should always keep it in mind? Decision making is more important than incisions. Decision making is more important than interventions. And finally, treatment should not be more harmful than the disease. So these are the three basic slogans or commandments one should follow. Because we know pretty well this patient, whatever you do, is not going to survive. If the life expectancy is less than 3 months, less than 4 months, whatever you do, no point in just pushing this patient to all modalities of therapy. Then ultimately what happens, the bill becomes so expensive. The one who dies, and the one who survives is financially dead.
In that way, he made sure that everybody us write it, and he wanted us to write it what is there, what is practicable, what we do day to day in our day to day practice. How not just to copy it from some other textbook and write it, whatever we are practicing it. So he was very good in that one, and he used to edit us, he used to help us in making it to look better. And I am really happy that I am a part of this wonderful event and a part of this book, Palliative Care in India book. And this will be one of the Bible, I can say, for people all over India to follow up. Practitioners, particularly an MBBS doctor also can read and practice, because for him also it is very, very important. And I think this is a very important moment in the history of Sri Shankara Cancer Hospital, I can say, sir.
Hearty congratulations and thank you, Dr. Professor Atma Prasanna, whose years of clinical dedication, compassion and scholarship have culminated in this textbook. Palliative care in India fills a long-standing gap in our literature now, and every clinician in this room knows how deeply that gap has been felt at the bedside.